Corral. I'm medical oncologist from the Clínica Quirón Oncoavance in Seville. I'm expert in lung cancer. I'm going to try to explain the most advantages in this Congress about lung cancer diagnosis and treatment. I think the most important trial presenting in ESMO during this year has been two. The first one is the FLAURA trial. It's a trial in a very selected population, EGFR mutant population, non-small cell lung cancer stage 4. This population have the EGFR mutation, and basically the trial compared a new generation TKI, osimertinib, versus gefitinib or erlotinib, and it's the first time there is an improvement in PFS in favor of the third generation TKI versus erlotinib or gefitinib. That's the standard of care. It's not only the improvement in efficacy, as well the improvement in patients with brain mets from the beginning, and as well less toxicity than the standard of care. So probably this trial changed our standard, and actually patients with EGFR mutation are going to move to another treatment. The second important trial is related with the immunotherapy. You know, the immunotherapy has revolutionized the landscape of the lung cancer in the second line and first line in PD-L1 positive patients. That trial, the Pacific trial, was presented by Dr. Pazares and published at the same time in the New England, and in stage 3 patients, non-small cell lung cancer treated with chemotherapy and radiotherapy together, were randomized to receive durvalumab, a new immunotherapy from AstraZeneca, versus placebo for 1 year, and the treatment with immunotherapy prolonged as well the PFS in 11 months with a statistical significance, and as well no make any detrimental effect in toxicity. So probably in the near future as well, we are waiting for the overall survival results. Patients with the stage 3 after chemoradiotherapy prolong the survival and the risk of metastasis with the immunotherapy as compared with the standard of care with the placebo. And the last study is a very practical study, was presented as well in the presidential session, and is regarding the way to follow up the patient. Actually, patients with lung cancer, resected lung cancer, are followed by X-ray or CT scan, but there are no consensus. This French study compared the X-ray versus CT scan and show there are no differences in overall survival or disease-free survival when you check with X-ray than compared with CT scan. So that's perfect, and we are quite in the clinic to follow up the patient only with the X-ray. And that's all. I'm very thank you for the attention.
Access to treatment, to novel therapies in Europe is far from being perfect or optimal. There are disparities even among Western countries, and there are some Western countries with a shortage of especially novel targeted drugs, immuno-oncology. But the major disparities come when we compare Eastern and Western Europe. In Central Eastern Europe, really also in countries that are joint EU and the drugs are registered at the same time as in the Western Europe through the EMEA, the availability of drugs is much lower compared to the Western countries. It comes also due to the actual availability, because it's not enough that the drug is registered. The drug has to be on the market and available to the physicians to prescribe and available to the patients. Even when we come to the life-saving drugs, which is the most worrisome, like trastuzumab, there are some Eastern European countries that in which there is no access usually to such life-saving drugs. So there are disparities, and with novel drugs coming on a large door, we will need to work on this to really ensure access to novel therapies to our patients. During this ESMO conference, there were quite a lot of sessions dedicated to better access to treatment, to better access to all therapies and diagnostic in cancer. And more or less, we agreed during these lectures or sessions, debate, that there are a few things we should do. First thing is that we should stimulate, or let's say ask all European countries to establish national control plans. And in national control plans, access to therapy should be a separate topic, not with some very concrete proposals how the countries will act to assure drugs. We have, in Slovenia, we also have national cancer control plan. And we put into this document that patients should have access to novel drugs, but it's not enough. We need to put some concrete actions and concrete deadlines until when we will ensure this. Another important topic is that we are not spending enough money for cancer care in Europe. Europe is different according to the GDP, but more or less in percentages, 10% of GDP is spent for healthcare, and out of this, only 5% is spent for cancer care, which is not enough. Cancer is the major pathology nowadays in Europe, and with 5% of spending of total health expenditure, even in the most wealthy European countries, it's impossible to cover for novel drugs. But we have also countries with GDP much lower GDP, and some countries spend for cancer care only per citizen per year around 20 euros. How can we cope? And the monthly costs for novel targeted therapies, immuno-oncology, are about 5,000-10,000 euros. So there are huge, huge disparities. So we will need to spend more money on cancer care, that's certainly in Europe. And another issue, the third issue, very important, is that also we will need to reconsider the pricing of the novel drugs. Novel drugs are extremely expensive. Of course, there is a research, pharma need to invest a lot of development of novel drugs. But on the other side, all the novel drugs are not equally good. Like Professor Ian Tannock used to say, if I'm paying should I pay for a Ferrari if I'm getting a Ford? So they are not equally effective. And that's why it's very important to know, and we should really thank ESMO to establish, ESMO established a magnitude of clinical benefit score. That is a tool that helps the clinicians and people who are making guidelines and proposing a new treatment. And it's also a tool for patients to look at, to score these novel therapies, whether they are more or less clinically meaningful. They also established a threshold. So they said, okay, for curative intent, A and B drugs are something that is really clinically meaningful. For non-curative, 4 and 5 is something. And of course, no tool is perfect. There are always shortages. But at least we have something to go to our authorities, to go to our health insurance and say, okay, at least for these drugs that pass the threshold, these drugs should be reimbursed as soon as possible. So these are the major directions through which we should act. More money, more fair pricing. The pricing is a very tough issue. It's non-transparent. We don't know exactly the price for which hospitals or some insurance companies are paying for drugs. So the pricing, cancer policy, and then making, let's say, I wouldn't say priorities. It's very difficult for a patient. It's also clinically meaningful for himself or herself if there is an improvement of 1 month on survival. But there are really some novel therapies for which it is a real consideration if they are they show statistically significant improvement to other therapy, whether they are really useful and clinically meaningful for particular patient. So these are the major paths on which we should work. And one additional thing we discussed a lot, and especially patient advocates discussed and proposed a lot, is the cross-border access to clinical trials. This is really important in Europe, in United Europe. There is really no excuse for not to offer the patient the possibility to participate in clinical trials all over Europe. So we will need to settle these things together, academia, pharma, patients, to get better access to clinical trials, because clinical trials can save lives as well.
LuCE is an umbrella organization for lung cancer patients in all over Europe. We are here to find out all the news, all the good things that happens, so we can report it back to our members. Because all the news, for all patients' organizations, and from lung cancer especially, it's so essential to know the good things that can give you hope. So we had to report them back to all the sick people and their caregivers.
Hello, my friends. On behalf of Lung Cancer Europe board members, I want to welcome you to visit our site, Lung Cancer Europe, to know about our fight to help lung cancer patients in Europe. So if you are interested in becoming active advocate in this field, please do not hesitate to contact us as soon as possible. Hugs from Madrid.